Good evening and welcome to our Wellness Wednesday webinar series. Thank you for joining us. My name is Debbie Leone and I am the Information Services Manager for the Epilepsy Foundation of Minnesota. Our topic today in our webinar is emotional health and stress management. And we are thrilled to be joined today by Kay King from Minnesota, who I will be introducing shortly. We do have a lot of great information for you tonight, so I am going to go ahead and, oops, wait a minute. I am going to share my screen so that you can see our PowerPoint. There we go. As I said, emotional health and stress management is our topic today. Oops, sorry, going too fast here. I do want to do a few housekeeping items. This is a 75-minute webinar, and so we are scheduled to end at 7:30. For the best technical experience, we do ask you'll probably want to close out of any other windows or apps that you may have open, especially if they're music or video streaming. We just don't want your computer to be lagging, your internet to be able to keep up. We will be emailing certificates of attendance to everyone who is attending tonight, just showing that you were here and that you did take part. And we are recording this webinar and it will be posted on our website. If you'd like to watch it again, it should be up within a couple of weeks. Or if you'd like to share it with any friends or family who might be interested. You will have the opportunity to ask questions tonight, and you can do that by using the Q&A icon that you can see at the bottom center of your screen. We are going to save all questions until the end, but you can ask them anytime during the webinar. So just click on that icon and you'll see that box pop up and you can type in your question and hit send. You are also going to be invited to use the chat feature during Kay's portion of the webinar. And so that chat is right next to that Q&A button. And you will be able to click on that and you will be, a box will open up and you'll be able to type in whatever comments you have. We do ask that you try to remember not to use the chat to ask questions because that might be getting a lot of activity and we don't want to miss your question. So please use the Q&A box in order to answer your questions. I do also want to give you a reminder that the content of this webinar is for educational purposes only, and it is not intended as medical diagnosis or medical advice. Any medical questions should be directed to your healthcare provider. Okay, so I'm just going to move something so that I can see my own screen. There we go. Our objectives for the epilepsy portion of this webinar are to increase your knowledge of how epilepsy and seizures impact emotional health, to understand the importance of emotional health and living well with epilepsy, and to gain tangible tools and resources. We want to be able to send you home with some actual tools you can use to help improve your emotional health and to manage your stress. I want to spend a few minutes talking about epilepsy before we get started with the emotional health part of it. There are about 50 million people around the world living with epilepsy. And in the US, 1.2% of the population lives with epilepsy. So that's over 3 million people. Of those, almost 500,000 are children and nearly 1 million are people over the age of 55. So even those two ends of the age spectrum account for a lot of the people with epilepsy. Epilepsy can be diagnosed at any time during someone's life. And in fact, 1 in 26 people will develop epilepsy in their lifetime. Epilepsy is a neurological condition, meaning it happens in the brain, and it's characterized by unprovoked recurrent seizures. And those two words are very important. Unprovoked just means that it's just happening in the brain. It's not happening because there is some outside factor. You know, there are other things that can cause seizures. Someone with diabetes who has a very low blood sugar may have a seizure. Someone who's going through alcohol or drug withdrawal can have a seizure, but those would be considered provoked seizures, and so they would not be counted toward epilepsy. Recurrent is the other word that's really important in epilepsy. And that just means that the seizures have a tendency to happen again and again. Seizures can happen at any time to anyone. In fact, 1 in 10 people will have a seizure in their lifetime. But if it's a one-time event, it would not be characterized as epilepsy unless it is recurrent and unprovoked. Some people call epilepsy a seizure disorder or a condition. So just know that if you hear those words, they mean the same thing as epilepsy. A seizure itself is a sudden, brief, uncontrolled period of electrical activity in the brain. And as I mentioned, seizures can occur with other conditions. And they, you can see this little picture of the brain lighting up the different areas. Seizures can look different depending on which areas of the brain are involved. So, you know, if it's your, if it's a part of your brain that affects sight, your sight might be involved, might be impaired. If it affects movement, then there may be movement. And sometimes people have seizures that occur over the entire brain. There are over 40 different types of seizures that can be diagnosed. So let's move into talking about emotional health in epilepsy. You know, a lot of times in epilepsy, we end up talking a lot about the physical aspects of it. And that's understandable because it's important to be able to figure out where seizures are coming from and what may be the best way to treat them so that we can reduce them or eliminate them. But emotional wellness is just as important as physical health. Having poor emotional health can really impact seizure control. If someone who has a lot of stress or anxiety may have trouble remembering to take their medications. They also, you know, if someone is depressed, they may not be motivated to do what they need to do to take care of their health, whether that's taking their medication or eating well or exercising or getting enough sleep. And we all know that stress is a very common seizure trigger. A poor emotional health can also disrupt your sleep, and lack of sleep can be another important trigger for seizures. On the flip side of that, interestingly enough, you know, poor emotional health can impact seizure control, but poor seizure control can also impact your emotional health. So if someone's seizures are not well controlled and they're spending a lot of time worrying about when the next seizure might happen, or they're feeling down or frustrated, it can just become a vicious cycle that they feel bad because their seizures are under control and their emotional health suffers. And then because their emotional health is suffering, their physical health suffers and their seizures get worse. So it's really important to address the emotional health. And for that reason, it's really important to talk to your doctor if you're experiencing any mental health symptoms, just as you would if you're experiencing any kind of seizure activity, you know, changes in your seizure symptoms. I do also want to just make a note. I know we have quite a few people on the webinar tonight who are parents of children or perhaps are caregivers of other people with epilepsy. And it's really important for caregivers, as a caregiver, that you concern yourself with your emotional health as well. It is stressful to provide care for other people with a chronic health condition. Things like worry and fatigue, financial concerns, and just the difficulty of seeing a loved one suffer with seizures or struggle with them can really take a toll. So it's really hard to provide quality care for someone else if you're not taking care of yourself and if your own mental health is suffering, if you're sick or you're stressed or you're sleep deprived. So please be sure to, you know, take care of yourself so that you can take better care of your loved one. There are certain areas of the brain that are commonly affected by epilepsy that can play a role in controlling emotions. And if someone has seizures that affect these areas of the brain, then they may be at increased risk of anxiety or of depression. And so that's one of the ways that epilepsy can impact emotions, is just by the seizures themselves. The second way Oh, wow. And let me talk just a minute. There may also, in noticing changes in your emotions, those may happen right after a seizure happens. There may be mood swings or irritability, emotional sensitivity, or that can happen at some time between seizures. So, the impact on the emotions can be very strong at different times in the cycle of having seizures and being in between seizures. Anti-seizure medications are another way that epilepsy can impact emotions, because it's well known that many of them have side effects of things like anxiety or depression, or possibly even thoughts of suicide. Interestingly enough, some anti-seizure medications can be mood stabilizers as well. So again, very important to keep your doctor informed. Just as you would tell them about anything physical, you want to make sure that you tell them about the emotional things that are happening. And we often recommend that people keep seizure diaries to keep track of what's happening with their seizure activity. It's not a bad idea to keep an emotional diary as well, so that you can really keep track of your emotional health and be able to identify and share with your doctor if there are things going on and what's happening in your life at the time that those emotional changes are happening. There are a lot of stressors involved in epilepsy, and I just want to talk about some of the more common ones. The first is unpredictability of seizures. For someone, especially whose seizures are not well controlled, the seizures can be very unpredictable. And so it can cause stress. It can cause things like embarrassment over having a seizure in public, fear of getting injured if you were to have a seizure and no one around you knows how to handle it. For some people, that unpredictability affects them to such a degree that they may decide to start self-isolating and not want to go out because they're worried about what might happen if they have a seizure. Relationships with family and friends can really be affected and cause stress in epilepsy as well. When someone is first diagnosed, it can happen that if the family members may get overly protective, and especially for young people, for teenagers and young adults, it can cause a lot of conflict if they're struggling to be independent and their family is really worried about them and is not willing to grant them that independence and wants to keep them close and safe. Another thing that can happen is that a parent with epilepsy may feel guilt about their inability to be the kind of parent they might want to be if they're sick and they're unable to care for their child the way they want to. Another thing that can happen is worry or about what may happen with friendships, or anger if friends are unable to understand what's going on with epilepsy and distance themselves from you. So there can be a real impact on that. Transportation is always a stressor in epilepsy. In Minnesota, a person with epilepsy can't drive until they've been seizure-free for at least 3 months. And that really leads to a loss of freedom in many cases. Being able to be mobile is one of the great joys of being independent. And when you no longer have that, it can cause some emotional stress. It can also lead to fewer social opportunities if your friends are not willing to invite you out anymore because you have no way of getting to where they're going. So, transportation can be a real issue. And then that can lead to issues with employment as well. If you can't drive, it can be difficult to get to work. And other employment issues also come into play. Just uncertainty over disclosing your epilepsy. Should you do it? When should you do it? Should you not do it? What's the reaction going to be from your employer or from your coworkers? Those are all things that can cause stress in the workplace. Concern and worry over whether you might face discrimination in the workplace, which is illegal, but it does happen sometimes to people. And for some people, their seizures may be so difficult that they are unable to work if they're that serious and strong and frequent. So employment can really suffer. And then that leads into sometimes financial concerns as well. That may be related to not being able to work. It could also be related to things like insurance issues. If you don't have insurance, or if you have insurance, but it doesn't cover the things that you need it to cover, doesn't cover the medication you need, or you have super high deductibles, all of those things can really create a lot of stress. And then just the stigma. We all know that people still don't understand epilepsy the way we would wish that they would, and that lack of understanding can sometimes lead to hurtful comments and actions in the workplace. An employer may assume things about your ability that aren't true just because they don't, because of the stigma surrounding epilepsy. And we have heard accounts of children who are denied after school activities or being able to go to certain camp events because of the stigma there, because people just don't understand. All of these stressors then can lead to fear and worry, frustration, anger, and all other negative emotions, which just really is a big ball of stress. If these stressors aren't dealt with and addressed and they're left to fester, it can lead to anxiety and depression. About 1 in 3 people with epilepsy may have difficulty with anxiety or depression, and that's even higher among those whose seizures are intractable, or they're difficult to or impossible to control with anti-seizure medication. Rates of anxiety and depression are higher in people with epilepsy than in the general population. And on the flip side of that, people who already have anxiety or depression are also at increased risk of developing epilepsy. And we don't really know why that is at this point. So with all these concerns and these connections between epilepsy and emotional health, it's really important to learn about ways to better manage stress. And that brings us to our speaker tonight, who is going to talk about ways to mind your mental health. Kay King, as I mentioned earlier, is the community educator at NAMI Minnesota, the National Alliance on Mental Illness of Minnesota. And we chose to include a session on emotional health in this webinar series, because it is such an important part of wellness in epilepsy. And we chose to cover this topic specifically in May because May is Mental Health Month. That also means that our speaker has been very busy this month. So we are fortunate to have her with us tonight. So I hope you will join me in welcoming Kay King. Kay, thank you for joining us.
Well, thanks, Debbie. We're actually going to switch screens so that you get control in Zoom if you're sharing your own slides. So we'll do that. But I'm delighted. We have a longstanding relationship that we have with the Epilepsy Foundation. So we appreciate that. So I think you're gonna have to stop share, Debbie, and then I will go ahead and share the screen. We are the state office for the National Alliance on Mental Illness. There's a chapter in every state, and there's also a national NAMI office in Washington, D.C. And we're working remotely. We have been since last April. So I want you to know that our website's probably the most important thing that you can remember from tonight, and it's NAMIMN.org. Be sure you put Minnesota in a search so that you get to the state office. And we have a wide range of classes that you can take on different topics of mental illness, and for all age groups as well. Debbie had mentioned to me that people joining us tonight, some are parents that have maybe children under 18, and I have a specialty area in older adults. So we really cover the whole gamut. We do training for professionals, healthcare professionals. We do training for families that have someone who lives with mental illness. We have things that are available for people who are managing illnesses themselves. So you also can find our support groups on our website as well. They're being offered online right now. And we have support groups for family members who have someone in their family that lives with a mental illness. And we have support groups for people who manage a mental illness. And finally, we have, and we always have had, we have a call-in that you can get resources. We're not a crisis number. I will talk about a couple of numbers that I'd like you to put in your phone later in the presentation, but we are business hour resource, and we can help you with tying you and being the bridge to some of the things that you might need for mental health. Do know that it's not one-stop shopping. Unfortunately, this is a health condition that really has a lot of hurdles to be able to get the help that you need. But we're working on improving that because NAMI does education, we do support, and we do advocacy. And through our advocacy work, we're really trying to build our mental health system. It's not that it's broken, it really never was built. So tonight we're going to talk about minding your mental health during COVID-19. But you know, it's not just COVID. It really is the confluence of the economy. Many people in the hospitality industry that I came from have financially been affected. Think airlines, think hotels, think restaurants and bars, think, convention centers. I think about small retailers. Many have closed, maybe have gone bankrupt. I sometimes tell people we're all in the same storm during this time, but we're in different boats. Some days I feel like I'm on a yacht. I have a paycheck and I have had one during COVID. I don't have anyone immediately in my family that is managing COVID, or I haven't lost anyone to COVID. But then some days things don't go as well. And then I feel like I'm in a canoe with no paddle trying to go up the Mississippi River. And the other thing is that, I live a couple of miles from where Mr. Floyd was killed. And we just yesterday celebrated 1 year, and I wouldn't say celebrated, but we marked on 1 year of his death. And there's been racial injustice came to a forefront and had a tipping point a year ago, but it's been going on for a long time, and it's weighing on people. It's been going on for hundreds of years in the United States. We also have had a trial, that concluded not too many weeks ago. And there are some other former officers that their trial's been postponed until next year. We lost Mr. Wright not too long ago in Brooklyn Center. So it's just been very difficult. Add to that contentious elections. Our election cycle in the United States is much longer than other countries, and you get some sense of what it's been like. And we've all been affected. I thought the word of the year last year would be pivot. I thought pandemic was too obvious. It ended up being, by the dictionary companies, pandemic. But people have just had to shift and shift and shift. Luckily now vaccines are pretty readily available, but people were, anxious about having to try to find vaccines not more than a couple months ago. And people have been anxious about even going back to some normalcy. It's hard after you've been secluded for so long. I'm going to talk about, the impact of COVID-19 on everyone's mental health, not just people who are already managing a mental illness. A little bit about diverse communities, there are discrepancies. And then we're going to spend most of our time on bullet point number 3, which is the steps that we can take to promote good mental health. So tonight's not so much about mental illness, it's about reducing stress and improving our mental health. I'm going to briefly give you a couple resources for suicide prevention. And I'm also going to talk about, well, what if some of the things you're experiencing are really greater than you can handle yourself? I think we're a society that prides ourselves on pulling ourselves up by our own bootstraps. And we turn to friends, we turn to close family members to talk things through. But sometimes, just as Debbie mentioned with epilepsy, we need to see our health practitioner. And so I'm going to talk a little bit about, well, when do you need to go beyond your own resiliency or your own resources and maybe reach out to someone like a health practitioner? Now, some of you have paper and pencil. Some of you maybe keep some notes on a tablet. But if you would please, just jot down some things you've been struggling with in the last 3 or 4 or more months. And it could be sleep. It could be that your sleep cycles are different now than they were pre-COVID. It could be that your energy level is different today than it was pre-COVID. And there are other things. Those are just to get you started. And then as we go through this presentation, especially because I'm going to ask ideas from the audience, that's where you're going to get to use the chat function. Put down ideas in the chat that others can learn from. And then when we get to the end of the program, think about, are there one or two things I heard about either through Kay, me telling some things, or some of your colleagues telling you things that you might be willing to try. And if I don't remind you at the end, I'll try, but if I don't remind you at the end, look back at what you wrote down in bullet point number 2. So I guess I'm not telling you anything you don't know, but lots of uncertainty. We think, that things are going to now open up and that we'll get back to maybe how it was before, but we don't know. We don't have quite enough research on some things yet. We don't know if we're going to have some variants of this virus. We don't know if small children are going to get a vaccine, meaning under 12, are going to be eligible soon for a vaccine or not. We don't know if money we put down a couple of years ago for a big trip is going to be refundable. We've got people that we love and know that are essential workers, and what long-term effects might they have, having been an essential worker and maybe having had COVID, appeared that they were healthy and did not have any long-term effects. Or maybe someone who's a long hauler who may have some lingering effects even though the acute symptoms of COVID have gone away. And isolation has been hard. I tell people I'm in extrovert prison, and I'm not really joking. I'm so extroverted that it's been hard. And although I teach lots of classes online, I get my energy from the energy of the people in the room or the energy of people on camera. And many people don't use their camera. I'm not saying that to shame you. I'm just saying it's really like me talking to a screen, and it really doesn't meet my needs entirely. Also, who thought that bullet point number 4, being too much with family, was a bad thing? But not everyone lives in a house with 2 floors. Some people are in 2-bedroom apartments or 1-bedroom apartments, and maybe 4 people are sharing a very small space. And maybe you're a pretty recent immigrant or refugee to Minnesota. And as you start out in a new country with minimal money, you might have multi-generations in your household. Maybe someone's an essential worker going out every day and then coming back to people that are in their 70s or 80s that are parents or grandparents. And a couple people are going to school from home, and some folks are working from home, and it's really hard to carve out your own space when there isn't very much space. And in greater Minnesota, broadband is an issue, and so just getting enough bandwidth for everyone to do their schoolwork or their work from home is difficult. And if you worked in some of the industries I talked about in the beginning, certainly could be worrying about bills. Yes, there certainly have been extra money for unemployment. Through last July, I think there was a $600 supplement, which was very helpful to people. Yes, they postponed evictions, but some of those things are now going to loosen up, and people owe money. They owe past rent, they owe past mortgages. And then also, don't underestimate grief. Grief, doesn't the same as mental illness. Grief doesn't equal depression. But there have been losses, and one person's loss is not another. And I'll just give you an example. Especially last year, if you were a high school athlete, you probably didn't have a state tournament. And maybe the pinnacle of your athletic career was to wrestle in the state tournament. You're not going to go on to wrestle at a college. You're not going to go on to wrestle in the Olympics. So really a pinnacle in your athletic career might have been that high school basketball tournament or that high school state wrestling meet. And those opportunities don't happen again. In college, a few people have been given a 5th year to participate in sports, but in high school, not so much. I've gone to several funerals that have been online, and they work just fine, but they aren't the same as hugging, the people that are grieving. I did go to one that would have been held in Pennsylvania, and it was held on Zoom. And I wouldn't have been able to go even probably if COVID had not been in place. So that was really a bonus. So just remember, you can also have your wedding reception a year later, or the memorial service can be a year later, but there's something about marking the date when it occurs. Now, you may not know what the first acronym is in bullet point number 1. It's an independent education plan. So some of us have children. not me, but some of us have children that have special needs. Maybe they have a reading disability, and so they get some extra services at school. Now, when this was online, some of those extra resources were available online also, but it was hard. And the independent education plan, like that would be some supplemental social workers, perhaps, or a school counselor, or it might be a reading specialist, someone in addition to the classroom teacher. And those are hard to manage even in person, but were much, much harder during COVID. The other thing is, I have older adults in my family. I've run retirement communities, so I have many friends that are 70 and older. I have an aunt who's 96. I finally saw her in person last October outdoors. And there's so many people that live in her retirement community that even if I had wanted to see her more often, there were so many people with limited outdoor space that had to be supervised by a staff person that every 2 weeks is as often as I could see her. Now their building is open again. So I've been able to see her regularly now, but it was very hard. And she will tell you that she missed, she had to eat in her apartment, couldn't eat in the more communal space. And that was just very wearing, very difficult. The other thing is that look at my background. I'm in a home office. This has been going on 15 months. Do you see any artwork on my wall? Do you see a plant in the background? I thought this was a little bit like a sprint. Maybe by last summer, I'd be back doing some classes in person, or I'd have some time back in the office with coworkers. And then I realized, no. Then I thought, well, last September, maybe as the new school year would start, we'd be loosening up. I didn't expect there'd be a vaccine, but, I thought maybe things would be different. So then all of a sudden, there's no middle distance race either. There wasn't a sprint. There wasn't a middle distance race. So now it's a marathon, right? We're 15 months. And so I have to say that, what am I waiting for? Am I going to be on hold forever? I have a desk chair, but not a great one. And so I'm sitting 8 hours or more at a computer screen. I wasn't doing that before. I was speaking in public. I was walking around as I was teaching. So it's time to, maybe make some more permanent changes. Maybe it means I put some artwork up. And then if you are a person who's already experienced some trauma in your life, maybe there have been unexpected deaths in your life long before COVID. Maybe you grew up in a household where there's domestic violence. Maybe you've been through a tornado or a hurricane. Maybe you've had a divorce, or you've had a job loss, been fired. Those are really traumatic experiences. And so that can be something where you felt helpless. But think about if you've already had trauma and then you put COVID on top of it, because COVID is really a catastrophic stressor. And this is about the only comment I'm going to make about mental illness, and that is the theory about mental illness is you're born with a predisposition, something puts it in motion. And what puts it in motion is often called a second hit. And certainly trauma can be a second hit. COVID-19 can be a second hit. Now, there are some racial disparities in vaccination. There's some racial disparities in how COVID affects different people of different backgrounds. And so let's just briefly talk about that, because I really want to get to some of the ideas that we have for reducing stress. So, people that have things like asthma, COPD, which is chronic obstructive pulmonary disorder, diabetes, there's a greater risk in communities that are diverse. So you probably read an article in the Star Tribune just a few days ago that talked about the metal shredder that's been closed down by the Mississippi River. It butts right against North Minneapolis. And that area right by that metal shredder has the highest asthma incidences in the whole state of Minnesota. And they just had a fire there. It's closed for the time being. And now I think in the Becker-Rogers area, they have also a facility there, and there was a fire there. But just now there was a combustible, some materials that were being stored there, not unsafely, they met the guidelines, combusted, so then there was fires that were put out. So that affects, of course, people's breathing. And we also have COVID-19 going on right now, which is an aerosol respiratory related illness. And so that's a bigger issue to talk about, about health disparities, but they happen in poorer neighborhoods at greater numbers than they do in more affluent neighborhoods. Also, the concept of redlining, you've heard it before. It happened, all across the United States, happened in Minneapolis, in the neighborhood I live in. But what happened is that it was made illegal, but it meant that the covenants and deeds for people's homes said someone who is Black cannot buy this home. Someone who is Jewish cannot buy this home. That's called redlining. And the way most Americans save is, if they can afford to own housing, is that is their nut, or that's their savings. So consequently, if you've been not allowed to save through having home ownership and valuation of your house going up in value, then you've had some institutional setbacks that others have not had. And so, I have great grandparents that came to the United States from Europe, and they had land right away. I don't know if they were given reduced prices to help them clear the land, but then they passed on wealth to my grandfather. My grandfather owned a farm then. And then my grandfather had two children, my dad and my aunt, and they didn't farm. So the farm was sold, but they got some money from the proceeds of the farm. And both my aunt and my dad owned houses. So some of that institutional wealth, goes down to the next generation. Also, many people that are immigrants and especially refugees often put together several jobs to make a living and may not have, because they're not full-time for anyone, may not have health care through health insurance, may not have a primary care clinic, don't have sick leave. When we are working in our building, I work in a building on University Avenue in St. Paul, and our cleaning crew has been quite stable for the 3 years we've been in that building. And so I try to use my Spanish when I can. And as I talk to our cleaning folks, they say, they make a decent wage, they believe, but they cobble together about 3 jobs to make that happen. And two of them lost one of those part-time jobs because during COVID, offices did not need to be cleaned in the same way because no one was working in them. And so that was hard. And so, they don't have that extra money, even though we have the Affordable Care Act that allows us to get some sort of insurance, doesn't mean that people have the kind of funding to be able to pay for that. And again, I grew up in a multi-generational household. My grandpa lived with us, but that's not as common anymore for 3rd and 4th generation people. But it is still the case for people that are refugees. And, refugee is being different than being an immigrant. An immigrant might be an IT professional that has a skill that someone in the United States doesn't have, and they immigrate. But a refugee is probably fleeing being killed. When you think of our Hmong allies that served with us in the Vietnam War, they would have been killed if they had not come to the United States. You think about people from Somalia, again, that's a refugee versus someone coming here for college. Now, think about who are essential workers. If you look in our long-term care facilities in the state of Minnesota, that's where you're going to see some of our recent Minnesotans. That's where you're going to see people from Liberia. That's where you're going to see people that are from Somalia. If you went to, the Savage Shakopee area, there's a large Amazon warehouse. And if you were there at shift change, you would see a lot of immigrants and refugees that are workers in our Amazon warehouses. And throughout this whole pandemic, our grocery workers, our postal employees, our people that do in-home healthcare, not everyone, but our cleaning crews, are greater portions of diverse communities. Now, I'm just going to let you know that you probably do know this, but Black Minnesotans are 6% of our population, and yet they have such a higher rate of death during COVID. I gave you a couple other states that have larger Black populations. Instead of Minnesota 6%, Louisiana, which is at the bottom of the Mississippi River, that's 32% of their population is Black. And you can see what percentage of COVID-19 deaths. Illinois, largest city is Chicago. Again, 39% of their state population is Black, and again, ours is 6%. And so you can see, again, this disproportionate deaths to ratio of population of that diversity. Now, this was written before we had what happened in Atlanta with the killings primarily of Asian women. And now that allowed a conversation to start. Discrimination against Asians has been going on long, long before what happened in Atlanta. But what's happened is that this particular COVID issue, it's been called things like the Wuhan virus by some political people on a federal level, on a regional level, on a state level. When you do that, be careful. Think back to the pandemic, the flu pandemic of 1918. You sometimes will hear that called the Spanish flu. It did not start in Spain, but by putting Spanish flu on that, somehow that can easily put blame on a population that has nothing to do with where that pandemic started. And so we have to be careful. There have been many, many attacks among Asian Americans. They just didn't come to the bubbling point of talking about them until we just had this more recent tragedy. But the microaggressions have been going on for a long, long time. And first of all, just think about how we refer and lump everyone Asian American. Think about it as someone from Japan, the same culture, same faith, same language as someone from China, yet they all get lumped into this big silo of Asian American. Is someone from India have the same culture, faith, background as someone from China? No. But again, we lump it all together. I've been to Southeast Asia, and so, Thailand and Laos and Vietnam and Cambodia are all together near each other, but quite different cultures, yet they're all considered Asian American. So think a little bit about words and how they matter. But if someone's under a great deal of stress and feel under attack, their stress rises, and people are already under a great deal of stress. So we don't need to make it worse by name calling and by dehumanizing people. This is near my house, George Floyd Square. Maybe some of you have been there. And of course, there were things to mark the occasion in this past weekend as well as yesterday. But if someone was already struggling with some mental health concerns before all of this happened last May, you can imagine that it might be worse for those people. But for pretty much all of us, we've been isolated and we've had some concerns. So what's that led to? For some people, anxiety and depression. And you notice I didn't say anxiety disorder or major depression. Those are diagnosable illnesses. But when we talk about just being a little bit fearful or not sleeping well, we might use the word anxiety. I'm a little anxious. That's not the same as a diagnosable illness. Or when we have days with no sunlight, we might say, gosh, I'm feeling depressed. It's the 18th day in January and there's no sun. That's not the same as being diagnosed with major depression. Alcohol sales have skyrocketed in the United States and they've skyrocketed in Minnesota. And it wasn't just replacing where we're consuming the alcohol, i.e. restaurants and bars versus at home. The sales overall in all places have increased. And I'm here to say alcohol does not mix with mental health concerns. Alcohol does not mix with mental health concerns. And we all are tired of COVID. People took some risks even before these last couple months when it was safer to do things. People took a lot of risks. They just couldn't go many more months with not getting back to their normal. So we are secreting maybe. Cortisol is a stress hormone. It's involved with fight, flight, or freeze. And that's good. It's good to have that when we're in danger, but it's been secreted at a high level for 15 months. And that affects your physical health as well as your mental health when you have that kind of secretion of stress hormones like cortisol. So it's important, that we pay attention to our whole integrated being. And Debbie talked about that. It's not just neck up and neck down. We're very much integrated. Now, when you have stress, it's not uncommon to be irritable. I've had to apologize a fair amount to family because I've been crabby. I'm not by nature too crabby, but it's been hard. And physical health, oftentimes that's the first thing we report to a health practitioner, but people's digestive systems certainly have been affected during this time. I think lots of people have had some sleep issues. And of course, when you don't get enough sleep, that can lead to irritability too. I think, headaches, people that manage mental illnesses have a greater incidence of headaches and vice versa. Particularly migraines. People who have migraines also have a greater risk of major depression and anxiety disorders. If you already live with something like diabetes, epilepsy, heart disease, high blood pressure, some of the stress can make them worse. It's harder to keep your blood sugars level. It's harder to keep your blood pressure at an even keel. And then for some people, it can be a tipping point. If you're pre-diabetic, maybe the stress could have been a tipping point for you, and now you are diagnosed with it. Now, my favorite part, we're going to talk about ideas to reduce stress. And I'm looking to you. I've never done this presentation without getting some good ideas. So I'm really hoping that you will help me with ideas. And I'm going to have you put them in anytime in the chat. Just type them in the chat. And Debbie said she'd monitor the chat. And I'll stop a few times and just say, what's in the chat? So let's get started. First of all, I work from home. I tell people I live at work, right? I live at work, literally. And so I'm a night person. So I'm looking at my emails sometimes at 10 o'clock at night for work. And I didn't do that before. I work a lot. I work good 50 hours a week anyway. When I was in the hotel business, I worked lots of 6-day weeks, lots of 12-hour days. It's a 24/7 kind of operation. But now I find I bleed a little bit on my boundaries because I can. And when I couldn't go out, then I tend to lean a little more towards work. I also have really high expectations for myself. I'm sure if I had children, I'd have high expectations for my children. I certainly have always had high expectations for the people that work for me. But, these are different times. So I try to remind myself grace and space, sort of a mantra. If I can't sleep right away, I just grace and space, grace and space. People are doing the best that they can, including ourselves. And also, it's good to know when you work the best. I can be in a lobby of a hotel with 1,000 people checking out, and I can be perky at 7 a.m. But to be honest, my best time of day to do budgeting or major reports or writing new curriculum probably is from about 3 in the afternoon till midnight. So if I can, if you're the boss, sometimes you can, adjust when you do some of those hard things, try to make those coincide with your best part of the day. Now, you have a lot of balls in the air. You might have children that you have to work around their best time of the day. And you may also supervise people, and you may volunteer, and you may do all these other things. And then also, what do you do well? When I was the boss, an executive director of a retirement community or a general manager of a large hotel or resort, I want to hire the best people that have skills even better than I have. Now, do I know how to lead them? Sure. Do I know how to get them the tools they need to do their job well? Absolutely. Do I know how to motivate people? Yes, I do. But do I have a CPA background? No. So I want to hire a really good finance person that maybe does. And I can read the statements and I can ask the right questions, but their accounting skills are always going to be better than mine. So even when you're volunteering, right, you can do the same thing. Hire volunteers that work for you that have some skills you don't have, or partner up or marry someone that complements you as well. So I'm going to talk about some general things, but I'm going to get more specific on some topics like sleeping and movement. But for example, we actually at NAMI, we tried out some meditations. And so my coworkers really have liked these applications called Calm and Headspace. And they also have a subscription fee. They're not free. Now there's some free ones out there, and I'm hoping you'll share maybe some free ones that you like. But what NAMI did then was we actually bought a subscription to Calm, and we have given the password to our 35 employees. And so all of us can use it. A few of my coworkers said they use it to help them go to sleep. They do it right before they go to bed. So those are a couple suggestions, but there's lots of other meditative things you can use that aren't just apps. You maybe have a book you like that has meditations in it. You might have maybe a blog that you follow that the person that's doing that blog has had meditations. I want to talk about yoga. I don't practice it. I practice Tai Chi, and I've practiced it for about 15 years. But what I like about Tai Chi, and I'm told similar in yoga, is it has a meditative quality to it. So I know all the forms of 4 different types of Tai Chi. So I can do those movements really without thinking. So when I do my class, which is about 1 hour and 15 minutes, I can use that time for meditative purposes. And, for me, Tai Chi and yoga, it's good for flexibility. It's good for balance. Both of them are. It's good for this meditative quality. It's not an aerobic exercise, but I find that my energy shifts. And that didn't come the first year or so that I did Tai Chi, but I find that my energy shifts. And that's what keeps bringing me back to Tai Chi. Also, music can really soothe your soul. And I often ask people, what are you listening to? I like a wide range of music. And, I played a trumpet when I was younger. I sang in choruses, but I really like listening to music. And I've gotten some terrific recommendations by just asking coworkers, what are you listening to? And I did this even before COVID. Now, I'm going to tell you, an example. I first, right out of college, I was in the hotel business. And so I lived in South Carolina in the Gullah region and the Sea Islands. And I have to say that I just worked so much that I never went to any live music. But there is a group now today called Ranky Tanky, and they do the Gullah music of the Sea Islands. And I was lucky enough before COVID to hear them perform live at the Dakota Jazz Club. And they speak to me. And so I never would have heard about Ranky Tanky unless one of my colleagues hadn't told me about them. So I bet you have artists or a specific song or music that you like. Put it in the chat because we would love to hear other people's ideas. I even like opera, not all opera, but I do like opera. So, if there's something that speaks to you, share it. Naps are good, but they need to be really pretty short because you don't want to nap so much that it interferes with the largest block of sleep that you have, which for most of us should be about 8 hours. So again, you want to go in that pre-REM sleep in a nap. You don't want to get into the deep sleep because it does seem to affect your other larger sleep. I'm going to give a pitch for a Minnesota company. I don't do jigsaw puzzles very often, but last summer for my birthday, I got a state fair puzzle and I love the state fair. My wedding reception was at the state fair. Puzzle with a Twist is a Minnesota company, and it was a state fair illustration, good looking puzzle. And when I started doing it, they changed the picture on the front. The puzzle pieces didn't match it. So all of a sudden there's a Ferris wheel that isn't on the picture. And Fairchild, the mascot, instead of his green and white striped vest, is wearing some different color. Makes the puzzles a lot harder. Now, if you're hoping to prevent memory loss or Alzheimer's, there's no research that says it does that, but I do think, it uses a different part of your brain, gets you out of that workspace kind of thing, gets you on a different track, gives you a respite, putting a few jigsaw puzzle pieces in before you go to bed. So put ideas. I'm not going to stop yet, but I want to talk to you about breathing. It's one way to reduce stress. And so I'm going to teach you a breathing exercise, and it's really not too hard. It's called the 4-7-8. You breathe in through your nose to the count of 4. You hold your breath for the count of 7, and you exhale through your mouth to the count of 8. Now, when you're new to it, don't hold your breath for 7. You're not used to it. But I'm going to do the 4-7-8. So now watch me do it, and then I'll have you try it. And you're muted, so you're not going to sound funny. I'm going to sound funny. So through my nose for 4, hold it for 7, exhale for 8. Here we go. So I'd like you to try it. 4 through the nose, hold it for as close to 7 as you can. Don't make yourself dizzy. And then exhale with 8. Ready? Here we go. Now, how do you remember to breathe? Most of the day, I'm breathing through my chest, but we want to do abdominal breathing. And when I'm doing Tai Chi, I do abdominal breathing, right? Diaphragmatic breathing. When I used to play a musical instrument, I did diaphragmatic breathing. But now I tend to breathe from my chest. So to remember to do this 4-7-8 diaphragmatic breathing from my stomach area, my diaphragm, every time I wash my hands, which is often because of COVID, I'm like, breathe. So as I wash my hands, I do the breathing exercise, okay? So at least 20 times a day, maybe more, I'm doing a breathing exercise. Now, if this works for you better, remember when you're in kindergarten? I barely remember kindergarten, but when you were in kindergarten at Thanksgiving time, you traced the turkey with your hand. Another way to remember to breathe is to trace your hand. So you breathe in, going up, breathe out, breathe in, breathe out, breathe in, breathe out. And you have 2 hands, most of us. So then you would get 10 breathes in and 10 breathes out. It's just a way to remind you. So breathing can be very helpful. And again, with yoga, Tai Chi, those include breathing. And maybe the 4-7-8 will help you. Now, movement. You notice I didn't say exercise. Our goal is to do 30 to 60 minutes a day of movement, but it doesn't have to be in one hunk. You can do 10, 10, 10, 20, 20, 20. And, the best way for me is to do it all in one time. So for me, I walk. Now, I went on the El Camino in September of 2019 before COVID. And to get in shape to do 15 miles a day, I did a lot of walking. Luckily, I kept walking every day afterwards, and then we got into COVID. So I bought adult snow pants this past winter so I could walk outdoors. And I did, probably missing just a handful of days in the last year and a half, almost 2 years. So for me, it works. Now I'm bored stiff with walking. I'm walking my neighborhood. I'm tired of my neighborhood. But I have to say that when people say to me, well, okay, why don't you just go to a park? Or, okay, why don't you, set up times to walk with other people? If it's complicated where I have to get in a car and go someplace, I'll blow it off. If I have to keep making appointments and the friend changes the time, I'll blow it off. It's just easy to throw on the shoes, walk out the back door. So that's what works for me. Now, I do mix it up a little bit. In good weather, I bike a little bit instead, but find something for movement. I hate cleaning. I hate cleaning. And so for me, I crank Motown to the highest level and I scrub toilets. So, that's moving. During the summer, and now I'll probably do it this summer, and when I have a break, I go outside, I take off my shoes, I take off my socks, I plant my feet in the grass, and I wave at passersby like a middle-aged beauty queen. Few people wave back. I deadhead a few flowers, but at least centers me by having my feet on the ground. So I'm sure you do things also. And if you do, put them in the chat function. So now, Debbie, I'm going to ask you. Debbie is like Richard Dawson of Family Feud. So Debbie, are there things that people have put in the chat function?
Well, Kay, I think people are being a little shy. We did have someone mention meditation, but I don't know if people are just not able to think of anything or they're just a little nervous about typing it in. For those who may be having trouble figuring out where the chat is, just a reminder that it's at the bottom of your screen. It's like a single little kind of a thought bubble there. And if you click on that, it will open up. Okay, now we've got mindfulness or journaling just came in. I'll add one, and that is, I'll add two actually. One is playing with my dog. It's a great stress reliever. And the other one is just finding something funny on YouTube to watch, whether it's, silly fails or whether it's a clip of an old comedian that I haven't listened to for a while.
Well, thank you very much. And keep putting ideas as they come to you. Yeah, we'll stop again. Now, nourishment. I have to say that prior to COVID, I was not drinking enough water. So in the hotel business, we have coffee breaks where we use just tap water and we put slices of lemon, maybe some berries, maybe cucumber slices. And all of a sudden that tap water tastes pretty good and it's chilled. And I thought, well, why can't I do that at home? So every morning I take a pitcher and I put in tap water and I cut up whatever we have, which might be cucumbers or something inexpensive. And then I pour water throughout the day. So I keep that near my office area and I'm drinking a lot more water. I also love Cheetos. I'm sorry to introduce this if you've forgotten about them, but Cheetos are a fine product and I still buy it. But I was putting them on the pantry shelf eye level. And so every time I'd open the pantry, there they were. Now I still buy Cheetos, but they're on the top shelf and they are lasting 2 weeks instead of 1 week. Also, as soon as I bring home vegetables and fruit mostly vegetables, from the farmer's market or from the grocery store, if I don't cut them up right away, sometimes they turn brown and I have to put them in the organic recycling. Or I grab Cheetos instead of carrot sticks because I didn't cut up, the vegetables. Like I like raw cauliflower, but if I don't cut it up, it's not going to get eaten. Instead, I'm going to grab something handy. We like nuts at our house. And so, I could easily scoop out a whole handful of cashews, but they're pretty high calorie. They're pretty healthy. And so I try to portion those into a serving size. And so then I'll grab cashews maybe instead of chocolate bars. So those are a few tips. If you think you're using alcohol differently than you did before COVID, or maybe you were sober and not using anymore and you've started to use, just be careful. There's empty calories in that and it doesn't really mix very well with stress. And then for emotional eating, my only comment is I am 20 feet from the refrigerator. I'm not that way at work. I'm not when I'm out speaking someplace. And so, it's not hard to run to the refrigerator. And know that I use food to celebrate. So I want to go out to eat if it's a celebration. I also eat when I'm bored, not always when I'm hungry. Sometimes I'm just bored, not because I don't have enough to do, but there's a lot of sameness to this as well. My apologies, I forgot to shut up our answering machine. I'll be right back. Not only am I 20 feet from the refrigerator, I'm 20 feet from the answering machine, so thank you. Now, sleep I'm going to talk about, and sleep really is important. I can't stress it enough. There's quite a bit written about it, so you don't need to listen to all the details here. You can read about it as well. But I'm going to give you a few pointers. There are a number of cycle components in 8 hours of sleep. And if you don't get enough, you don't go through all the cycles. And one of the functions that happens during sleep is pruning, kind of like pruning tree branches. And so it's how memory gets stored for us. And, these different components of sleep, you need to go through those cycles so all those functions take place. Think of some of the functions as janitorial services, kind of cleaning out our mind at night. So it is important to get that full cycle. Now, that being said, if you're having trouble with sleep, it's probably not one solution. It's probably a number of things you need to do. Going to bed at the same time is important. Even when it's a day off, it's good to still try your best to go to bed at the same time and to get up at the same time, even again, if it's a day off the next day. Of course, we're going to have a 1 o'clock in the morning party sometime, but by and large, you're trying for a routine. Now, the other routine you're trying for is those rituals that you do to prepare yourself for sleeping. And one ritual might be reading a book to your children. Another ritual for me is personally reading. The last thing I do at night is finish the newspaper or read some of my book club book, and then I shut off the light. And I do read in bed, not the best. If you're sharing a room with a partner, careful, because some people don't go to bed or go to sleep at the same time. Also, you want to restrict blue light. Our devices have blue lights. TVs have blue lights, telephones have blue lights, and the adjustment settings that are on some of those devices, the literature says not adequate enough to restrict the blue light enough, because that affects our melatonin, which is a chemical that is in our brain. So you might need to do that. It's probably the room where you sleep is probably where you should have your best window treatments. I wish I had great window treatments on every room, but the sleeping rooms are really important. It's important to be about 72 degrees or a little bit less for sleeping. That's optimal. So in the winter, we shut off the radiator, in our old house in the bedroom and just put on blankets if we need to. The Insomnia Coach app is a good one. It's free. The VA developed it, and they developed it with people managing PTSD in mind, post-traumatic stress disorder, but anyone can use it. It's actually a pretty good sleep app. So that's free, and that's listed here. And so consider possibly using that. iMasks are just for airplanes. You certainly can use those. And again, depending on, if you're sharing space with other people in your sleeping quarters. Control what you can. This is hard. There's news feeds available all the time. And it's really important to probably restrict some of that. That trial that we just had was very important, but there were people that were watching a lot of that, and it's very hard. That was very traumatic information about Mr. Floyd's death, and seeing that video over and over again, very traumatic. Or when the planes hit the Twin Towers during 9/11, CNN played that over and over and over again, and it just is not healthy for us. So decide, when you have your news on and when you have your news off, and restrict that somewhat. Also, we can decide leaving our house or not during this time, washing our hands or not. We just also came off cold and flu season. And so, you need to take precautions in washing hands and things during those kinds of seasons as well. And, determination about wearing a mask, what you're comfortable with. The CDC will give you guidelines and the state will give you guidelines, but, it's important for you to decide what's right for you. And then obviously cleaning surfaces are important because of other transmissions like flu and colds, not just COVID-19. And for the routine, I'm not saying you have to follow this routine. I just would like you to see that it's important to make time for meals. And you want to keep your blood sugar even throughout the day. Doesn't have to be at 7 a.m., but it's good to have many small meals maybe, or whatever is your pattern. It's good to do your hygiene every day. I shower at night. Doesn't have to be at 8 a.m. Also, I dress up when I walk into my work office. I don't wear sweatpants. I actually have shoes on. And I do that because it psychologically prepares me that I'm at work. I could wear sweatpants. You can only see me from the chest up, but that's helpful to me. You don't have to do that. You can do your own routine. But then when do you start work and when do you end? You should have some boundaries on that. Doesn't have to be at 9 a.m. Could be when do you start helping your kids with school? It could be when do you do your volunteer work? And then take some breaks. You know, you don't have to have your 30 to 60 minutes in one hunk. So it's good to stretch every hour. It's probably good to get up from being in front of a screen or sitting. And, you know, we need to reach out socially as well, right? Check in with others, maybe by Zoom, maybe by FaceTime, maybe outside. You know, we need to do that as well. And if you're supervising people, everybody's a little different. Some people need to check in with you daily when you're supervising them. Some people want to be left alone, and once a week maybe is plenty. Now, I heard someone say journaling. I'm going to give you a resource. You can look online, but there's some people out there that teach journaling. Natalie Goldberg, I don't know her, but I've seen her material. So Natalie Goldberg might be someone if you want to learn more about journaling. I don't personally journal, but I do before I get out of bed every morning. I think about 3 things I'm grateful for before I step out of bed. Some people keep a gratitude journal. Some people, like me, I keep my calendar on my phone, but I also use an old-fashioned day timer. And that's where I put a few notes. That's where I saw a bald eagle as I was walking in the neighborhood. I'll put that in my day timer. So in some ways, I guess it's a little bit of a journal for me, but mostly it's my to-do list and things like that. So I think it helps. So I'm going to do one more idea, and then I'm going to check in with Debbie, and then I'll probably skip ahead to talk a little bit about when is it a little more than you can handle yourself. What should you do? Look at animals. Nothing needs more to be said, but you can foster animals to get them ready for adoption. And then animals, especially dogs, get you out walking. And that has added benefits in addition to the unconditional love, hopefully, that your animals give you. Okay, anything, Debbie, to talk about in the chat?
Yes, we had some votes for nature activities. So things like spending time outside, going swimming, bird watching, just generally spending time in nature.
Excellent. Now, positivity, NAMI actually does offer some 15-minute sessions on positivity. So if you go to the NAMI Minnesota website, you'll get some ideas. There's quite a bit written about it. But some of you also mentioned, you know, watching a YouTube video. I have to say, I am not much of a TV watcher or Netflix watcher, but I had Netflix because I was watching movies that had mental health themes, because I was doing a kind of a session on movies with mental health themes. And someone said, well, you've got Netflix, why don't you watch Schitt's Creek? And I'm like, okay, because I really like Eugene Levy and Kathleen O'Hara. Oh my gosh, I laughed out loud. So I'm sure you have TV shows or past or present movies that really, really speak to you and hopefully get a smile or a laugh. But if you have any of those, put those in the chat as well. Volunteering, I think it was hard for people to come up with what could they do during COVID. That's opened up a little bit, but I'm just going to give you a couple ideas. You can always write to people. Forget about COVID. You know, people like getting mail. So if you have an older adult in your life, my sister is in her early 70s, and she also lives in adult foster care. I've always written to her once a week. I carry postcards in my computer bag or in my purse, stamped, and I just say what I'm doing that day. So she gets some mail. Well, I send 20 cards a week now during COVID. I sent 10 before that every week, birthday cards, anniversary cards, and I write in them, or postcards to my sister or to my 96-year-old aunt. So my point is, that's something you can do. You could write to a service person. You also could write to an older adult that you get paired up through your faith community. Nursing homes and assisted living, people were eating in their own private rooms because of COVID. So you could make tray favors. You know, if you did one meal one day a week for a building that has 400 residents, think about how many paper cranes that you would make for each tray favor. And you can write on a Valentine heart. Your family can all sit down at a table and make 200 Valentine hearts with love messages on them. And the dietary people at an assisted living or nursing home can put those on the trays. There's a lot of facilities. There's a lot of days in the year, and there's a lot, 3 meals a day. So there are things to do that can be done at a distance that don't have to be done in person. Now, I'm just going to say, besides, trying to not look at blue screens before bed, it's really important probably not to bring the technology into the bedroom, partly because of the blue screen, but partly bedrooms are for sleeping. So again, you're trying to get your best sleep if possible during this time. Now, quiet place is hard to come by. For some people, it's been outdoors. If you live in small spaces and have multiple people in the house, that may be outside. So you buy the adults snow pants, so you can even be outside a little bit in the winter. We're lucky, now we're in good weather. And it looks like, vaccines are pretty prevalent now, and that's good. You can't go through life and get better from any health condition without some faith, spirituality, and everyone's different in that area. But other cultures often come with a faith tradition as well. Some of our new refugees and immigrants come with a common faith tradition. So one place that you can find reduction of stress is in your community. Could be a faith community, could be a community that's because of ethnicity. But it connects you to people that might have a common language, common culture, and maybe a common faith. So just remember, no one gets better from epilepsy without, movement, good diet, medical care, and probably your spirituality. Nobody gets better from a mental illness without all those same things. Nobody gets better from cancer without those same things. It's really part of a whole program of things we do to get better and feel better. Now, we want to stay connected to people, but distanced enough so we feel safe and we're not transmitting. So it's important for people to get vaccinated, of course. And, we've had to make some adaptations. I know that I play Farkle and Yahtzee with regularly online. I play a tournament bridge once a week online. And some of that will shift back as we can gather again, but I've had to do workarounds to meet my needs socially as well as keep my brain active. It's understandable that people feel guilty, maybe guilty that they didn't lose their job and people they know did, guilty that no one in their family was sick during COVID, but other people have had a death perhaps, or someone who's a long hauler with COVID or lost their smell or sense of smell. So I'm just saying that guilt is normal, but it's important to, if it's really interfering with your skills of daily living, that's when you might reach out to someone like a health practitioner. So it's normal, but make sure that you address it if it's more than you can handle yourself. I told you I've had to apologize a few times for my crabbiness. It's important sometimes to just take a break. Maybe you're going to have a discussion and it isn't going well, then just make an agreement that you'll address it again later. Okay? It's easier said than done, some of these things. But the last bullet point on this one I do want to talk about just briefly, and that is, change how you talk to yourself, because we are loving and kind to our coworkers and to our family members often, but our messages to ourselves are like, oh, look at my wrinkles on Zoom, or, oh my gosh, I should whiten my teeth. And just remember that our self-talk isn't always as kind and loving as it is to the external world. So when should we worry that something's greater than we can handle ourselves? So I'm just going to give you some guidelines. If you have some numbness, I don't mean tingling in your fingers. I mean, you're not feeling your feelings, right? Or you have some fears. When we had some lockdowns, when Mr. Wright was killed, there were some curfews and things that made people fearful. If you are eating too much or too little compared to your usual habits, or sleeping too much or too little, that's a change. If you're having trouble concentrating, that's a change probably. When you're under stress, that's not uncommon to have some memory issues or difficulty concentrating. If you've been sober and not used tobacco and alcohol for a while and you're using again, that's a change. And certainly, if you've had some aches and pains, or you've had some gastrointestinal issues, these are all times to get in to see your healthcare practitioner. Now, if you've already seen someone for mental health issues in the past, but have been doing well and you didn't feel like you needed any counseling, it's okay to reconnect with someone you've seen in the past. And you can also, through your health insurance, perhaps find someone. Now, we are at 7:30, and I have a little bit more, as does the Epilepsy Foundation. So I think I'm just going to defer to you, Debbie, but some people might need to leave because you planned for 7:30. If you can stay with us, we probably have about another 5 minutes. What do you think, Debbie?
If you want to finish up yours, I can probably get through mine pretty darn quick.
Okay.
I'll cut back, but yeah, we don't want to keep people on too long.
So thank you. If you can stay another 5 minutes, great. So thanks. Now, EAP, I want to make sure you know what it is. You, or perhaps a spouse or partner in your family, might have an employee assistance program at a workplace. And it's a free benefit if your organization has it. Not everyone does. NAMI has it. We're a small organization, and you can use it for some counseling sessions. It's confidential. It's a company contracted by your employer. And, you don't pay any fees, co-pays, anything. It's a benefit. At our EAP program at NAMI, we get 3 counseling sessions. So use them. Every year it gets reset, so you get 3 more. And so you can use them for marriage counseling. You can use them for some anxiety maybe you're feeling during COVID. You can use them to learn how to communicate more effectively with your adolescent in your family. So also, make sure you talk to, if you're working or you're volunteering, make sure you let that supervisor know if you're struggling a little bit. Maybe some accommodations can be made. So that's okay. And then check with your health insurance, about therapists, for example, for some talk therapy. And if you don't have insurance, there are organizations that can help you with MNsure to see if you're eligible, and you should be. But the other thing is that you can also go to mental health clinics where they have sliding scale. So if you need any of those kinds of resources, you can call NAMI's helpline, and we can tell you about the community-based mental health clinics. And just, careful, snap out of it, toughen up. We're all in the same boat. It's okay to say some of those things, but it's different for everyone. And so saying something like, I know exactly how you feel, I've also, been laid off. We don't know exactly how anyone feels. We can say, I was laid off also. I get a little idea of what you must be going through. That's okay. But I know exactly how you feel. I think I would avoid that. When I'm on a staff call, our staff meetings once a month, if I see a coworker that doesn't have their camera on, and they usually have it on, I might call them and say, I miss you. We haven't seen each other in person, but you didn't have your camera on today. You okay? And they might say, oh, I have just bad hair. But it could be, I'm not doing so well. So you can reach out to people that aren't just people you supervise, especially if something's different. Now, these are the phone numbers I mentioned I'd like you to consider having in your phone. And these are crisis numbers, and they're mental health crisis numbers. Not just suicide prevention, but crisis numbers. So it would be good for you to have *274-747 in your phone. And that is to reach any of the 87 county crisis numbers in Minnesota. We have 87 counties. And you have to be using a cell phone to use that *274-747. And then there's a national crisis text line. So you can text 741-741. We'd like you to put Minnesota in the message. That way the responder hopefully would be a Minnesotan because they're going to know the resources, but that's a national text line. Both of *274-747 and the 741-741 are 24/7, 7 days a week, 24 hours. The 1-800 number is national, and it's also 24/7. The 1-800-273-8255. Again, pass these out to other people too. Anyone can use these numbers. And, take a class from us and we can tell you when to use 911 versus when to call the county crisis number. We teach classes that talk about that. Here's my email. It's my initial K and then King @NAMIMN.org. And I'd be happy to put you in touch with resources, or let's say you're a parent with children under 18. I have colleagues that work with that age group and parents with kids that age. So if you email me, I'd be happy to give you a resource or steer you in the right direction. So if you take down my email address, my initial K and then King at NAMIMN.org. So I'm going to pass it over to Debbie. Thank you for your patience, and take other classes because I have way too much to talk about. Thanks.
Okay, I'm trying to get my camera to come back on. All right, Kay, thank you so much for all that wonderful information and your insight. I so appreciate you being here, especially during this very busy month for you, to be here and to share your knowledge with everyone. I do want to just quickly remind everyone who we are here at the Epilepsy Foundation of Minnesota. We lead the fight to overcome the challenges of living with epilepsy and to accelerate therapies to stop seizures, find cures, and save lives. And that really is what we are all about. I hope that tonight's webinar has provided some information that in some small way will help with those challenges of living well with epilepsy. Could you advance to the next one? I want to put a quick plug in for our information services department. We do offer free one-on-one support, not only for people living with epilepsy, but for their caregivers, for their friends, their family, and really for anyone who works with people with epilepsy. If you contact us, tell us what your situation is, what kind of concerns you have, we'll work with you to find customized tools and resources, or possibly refer you to someone else. And we deal with a variety of epilepsy related topics. So please don't hesitate to reach out. You can do that through our website. Where there are web forms available where you can just type in what it is you need, and we will reach back out to you. Next one. These are just the references for some of what we talked about tonight. And then the next one. I do want to make sure as we wrap up that I remind you that this is a series, our Wellness Wednesday webinar series, and our next one will be on Wednesday, June 30th, always from 6:15 to 7:30 p.m. And the topic for that one will be striving for independence. Our speakers that night will be Kevin Thomas and Kelly Mick from People Incorporated, from their Epilepsy and Mental Health Services program. They have some wonderful things to offer. So I'm really looking forward to hearing what they have to say on the topic. To register, just go to our website. You can do that on through our events calendar on our website. Once again, thank you to Kay King from NAMI for speaking tonight. And I just want to thank all of you who attended and who stuck with us for those extra few minutes. Everybody, please stay safe and have a good night.